Hi, my name is Carrie Ulrich, and I'm an e-patient with a rare disease, and these are my beautiful kidneys. Today I want to talk to you about the impact that social media is making on rare disease from a patient perspective. In 2007, I was diagnosed with a vascular disease called fibromuscular dysplasia, or FMD. I was also diagnosed with brain aneurysms. In 2009, I had a celiac bypass and a bovine patch angioplasty. So if I move throughout my presentation, please excuse me, I am part cow. Let's talk about what FMD is. FMD causes stenosis from an abnormal cell development in the arterial wall. So my arteries look like a string of beads. Normal arteries are nice and smooth and the blood can flow through without a problem. FMD can cause symptoms depending on what vascular bed is affected. Common areas are the renal and carotid artery. A patient with renal artery FMD may present with hypertension. Someone with carotid artery FMD may present with swishing in the ears, headache, neck pain. Patients with FMD are at a greater risk for stroke, dissection, and aneurysm. There is no cure for FMD, but there is treatment. Treatment consists of medication, angioplasty, stenting, and bypassing. I want to talk a little bit today about who is affected by FMD. FMD affects men, women, and children. It is more commonly found in women, but we are seeing it in men also. So this is a photo of Tim. Tim is from Illinois. He dissected his carotid arteries, and I met him through Facebook. The middle photo is of Jennifer. Jennifer was 39 when she dissected her coronary arteries. She is now the proud owner of 6 coronary stents. Jen also co-founded Midwest Women's Vascular Advocates with me. We met through Inspire. And Haley. Haley was 11 years old when she was diagnosed. Haley's diagnosis was confirmed upon autopsy. I want to give you an idea as to how many people are affected by FMD. This information comes from the Wall Street Journal in 2009. It is estimated that 2.5 million Americans have breast cancer. Everybody knows somebody who has been impacted by breast cancer. Now let's take a look at FMD. It is estimated that 10 million Americans have FMD. Many don't even know they have it. So FMD is a rare diagnosis. A physician may see FMD once or twice in their career, if at all. When I was diagnosed with FMD, there was no information given to me about this disease. I relied on the internet to educate myself about FMD. What I did is I researched the latest article on FMD. I contacted that physician who wrote the article, Dr. Jeffrey Olin of Mount Sinai Medical Center in New York. My husband and I shot him an email. We said, who do we see? What do we do with this diagnosis? Within an hour, he had emailed us back. He said, you're in the Midwest. You're lucky. You have a Mayo expert in your backyard. Go see Dr. Rook. And so in 2007, I went to see Dr. Rook, and another e-patient was born. This photo is of Dr. Rook and Dr. Olin. It was taken at the Society of Vascular Medicine conference in Minneapolis. You know, I found that rare disease in social media is not so rare after all. But I will never forget Dr. Rook, what he said to me as I was walking out of his office after that first visit. And in 2007, this was true. He said, "Carrie, don't go start a support group. FMD is so rare, you will be the only member." So what does an e-patient do when she is told not to do something? I started and co-founded Midwest Women's Vascular Advocates. We relied on social media to spread awareness. We anticipated a group of 4 or 5, and now it has grown to a group of over 30. We have over 400 fans on our Facebook page. We recently merged with the Joe Necro Foundation so that we could continue our mission to support and educate patients as a nonprofit. Let's talk about how social media is impacting rare disease. Patients are sharing experiences, both good and bad, in social media. Not only are patients participating in social media, patients are actively listening. We are in a new age of healthcare where we have patient experts. I want to talk a little bit about return on investment and return on engagement. There was a recent Twitter chat with Chris Boyer, and he shared with me his slide share on return on investment. And I'm really glad he did, because there was something that I really could relate to in that slide share, and that was return on engagement. Each patient, we're engaging with each other on social media. These community groups, like the Clove Syndrome community, we're connecting with each other, we're making a difference. We're talking about what works for us in healthcare. So what that in turn is doing is e-patients are increasing healthcare organizations' ROI. And that is important when you have a rare disease. As far as measuring the ROI, I will leave that to Chris Boyer and the experts. Let's talk about what works in social media. Mayo's community page is the best example that I have, and no, Lee AC did not pay me to put this slide in. This page is patient-driven. The discussion is steered by patients. Solutions are interactive with videos and articles. Focus needs to be on the patient's perception of what health means to them as an individual, not the perception of what health means to a healthcare provider. Empowering patients to participate is key. Encouraging patients to become their own health advocate. When I was at the Social Media Summit, I was really hoping to meet Phil Bauman. He is the creator of MD Chat and RN Chat. He took the time to teach me how to do an FMD chat. He direct messaged me explicit directions on what needed to be done. So FMD chat did start on Twitter, and now we do have a FMD chat on Facebook. And within 3 days, we had 8,000 views of that page. So I really believe that social media does work to help with patients with rare disease. One thing I do want to mention here is that there's a great new movement called participatory healthcare. And if anybody has the opportunity, please read the white pages by Dr. Tom Ferguson and the e-patient scholars. Patients are going to demand that healthcare providers be on board with the participatory healthcare. I want to talk about 2 barriers in social media. The first one translation, and global communication. This is Oystein. Oystein is a brain aneurysm survivor. He lives in Norway, and he has an incredible blog that's written in Norwegian. Unfortunately, when I press the translate button, not every word will translate, especially medical jargon. It does not translate in word for word. So I can see that as a barrier. This is Ashley Boita. Ashley is from South Africa. I worked with Ashley and her family to get her to Cleveland Clinic for treatment of fibromuscular dysplasia. And it was a lot of work because not everybody understood what really her disease was about. There was a lot of different terminologies the South African doctors used compared to American doctors. We did get her here to the Cleveland Clinic where she received renal bypass, and she will be coming back this November for additional surgery. But that saved her life, us connecting on Facebook. The other barrier I want to talk about is healthcare providers. They feel a pressure to participate in social media, and I understand that pressure. My husband is a busy family practice doctor, and he directs the emergency department at Mayo Health System's Albert Lee Clinic. And each day I'm like, you need to see this on Twitter, you need to do that. What I want physicians to know is you don't need to write content. You don't need to be tweeting. But take a moment to read what is out there. Be an active listener in social media. I think you'll learn a lot. So what are 3 ways you can make a difference using social media? Healthcare systems. I encourage your social media department to become involved with patient communities. Tweet events held by these communities. Help host virtual support groups. The Mayo Clinic Center for Social Media was instrumental in helping the Joe Necro Foundation do just this. This photo was taken at the Brain Aneurysm Awareness Night with the Minnesota Twins. Not only did Mayo Clinic tweet our event, they Facebooked our event, but they took this opportunity to raise awareness and education by doing a flip video of Dr. Brown, the director of neurology, explaining about aneurysms and explaining about the Joe Necro Foundation and what they're doing for research. E-patients' experiences need to be utilized for educating future and current healthcare providers. Consider including an e-patient on a web chat that you're hosting. The third thing, utilize YouTube. Interview patients with rare diseases to educate the public. Have a patient alongside a physician. Patients relate to other patients. And one more thing. This is one thing I don't want you to forget. Never underestimate the knowledge of an e-patient. Corn mazes are famous here throughout the Midwest. And this is a corn maze that I got out all on my own because I used my GPS. Thank you for listening.